So if your child is snoring or gasping at night, don't take it less lightly. It might silently ruin their health and future. Myself, Dr. Lovkesh Mittal, your ear, nose, throat and sleep apnea specialist. As a parent, these signs are very easy to miss, like loud snoring, choking at night, daytime sleepiness, lethargy, mood swings, and your kid is getting infected all again and again within 3 or 4 weeks. So these signs can lead to some serious disorder called pediatric sleep apnea. During my checkups, I always examine adenoids, tonsils, jaw shape, nasal shape of the child. This low oxygen levels in your kid and poor sleep can even lead to malnutrition and decreased height of the baby. So work on early diagnosis and early treatment, and so that disease goes without any damage.